Today I'm going to tell you how to think like a doctor, or think like a GP more specifically, because generalists do think a little bit differently to specialists. That's why this is the second video in a 3-part mini-series in the run-up to World Family Doctor Day on the 19th of May. Being a family doctor doesn't really change that much between May and any other time of the year, so if you're watching this in November, it's still just as applicable. Like I said, it's the second part in the series. Part 1 is about how qualified is a GP and what GP training involves. Now that obviously influences the way that GPs think, so if you haven't seen that, it probably is worth going and watching that first, but you don't have to. This does make sense as a standalone video. And we're building up to the season finale tomorrow, how to make the most of your doctor's appointment, because in order to make the most of your doctor's appointment, it might help to know what I'm thinking about and what I need to know in order to help you. So first things first, we need to talk about the elephant in the room, which is time. Most GPs in the UK only get 10 minutes per patient. That's not even 10 minutes per appointment, that's 10 minutes per patient. In that time, I have to read your notes, get you into the room, do the consultation that involves taking your history, examining you, figuring out a plan, and then doing what we need to do for the plan. So whether that's giving you a prescription or a blood form or an x-ray or whatever it is. Obviously I'm not going to do the x-ray, but I need to make a form and give you the form so you can go and get the x. I've then got to write up your notes before I can prepare for the next person. So whilst time isn't everything, and whilst time certainly isn't the most important thing, it is always a pressure that you have to bear in mind, and you have to see time as a resource. Sometimes different medical conditions can start off looking fairly similar, but the way that they go, the direction they take, will vary. That means that sometimes the best way of figuring out what's going on is to see what happens over time, and we can say, if this happens, if that happens, if the other happens, it tells us this, that or the other. So if you go and see your GP and you think, well, they haven't done anything, well, they might not have done something. They might not have been a good consultation. But it could be that they were thinking that time is actually the most useful test here. Sometimes it can pay to see time as almost like a blood test or an x-ray or something, and it will give you that information you need. And it's important to know when to use time like that, because sometimes it can be very helpful, but sometimes it really isn't helpful. Because at the end of the day, the most important thing, when you leave the consultation, when you leave the building, you're going to be safe. That might sound obvious, and it is obvious, and hopefully it's so obvious I don't really need to say it. But the significance of it for GPs in training is often quite big. It takes some getting used to as a doctor, and it takes a little bit of a shift in thinking, because it's easy to take for granted the fact that when you're a junior doctor, you see people on the wards. When you leave the bedside, then they've still got people watching them, they've got nurses to come and give them the medicines, they've got nurses to come and check the vital signs, and they'll call you if there's a problem. That's not true in general practice when someone leaves your room. And whilst it's a shift in mindset that you can get used to, it's not a shift in mindset that everyone can get used to, and I know some very good doctors who've really struggled with that, and it's easy to overlook that and not realise how important that is, either as someone who's not a doctor or when you're a GP, and you can kind of forget how difficult that shift is. And most of the time that isn't going to be at the front of the consultation, and I'll figure that out and be happy with it as the rest of the consultation goes on. It'll be just kind of simmering away in the background. Something else that I'm thinking about, which is really important, which is aligning priorities. That's your priorities and my priorities. Really, what's important is your priorities. I want to know what the medical problem is, but also how it's affecting you and what problems it's causing and what we can do to fix it. But also, I have priorities in terms of safety. If someone comes into me with a problem with the nail and chest pain, the fungal nail infection, if it's important to that person, it's important. We want to deal with that. But in the there and then, if you're having a heart attack, you get the idea. It's a bit of a glib example, but you get the point. Occasionally these things can lead to a little bit of a disjoint of priorities, and getting on a level and seeing eye to eye. Part of that is going to be asking questions to find salient information. By salient, I mean what's important for you. So firstly, I'll want to hear you talk about it. I'll want to know what you're thinking, what's happening, how it's important to you in your own words. Once you've told me about what's going on for a couple of minutes, I'm going to be thinking, well, what do I need to be asking in order to get the information that's most important, to get to the heart of it, so we can figure out a plan in 7 minutes. Ideally, that will involve a diagnosis and treatment. If it doesn't involve a diagnosis and treatment, it needs to involve a plan to get us a step closer to that. And that'll probably involve a list of possibilities, a way of narrowing down the list, and a way of treating things in the interim if possible. So to some degree, you're working with the best information possible and you're working with an evolving plan. That leads on to probably the final and possibly the most important bit, which is dealing with uncertainty. Now, a lot of the time when you come and see me, I'll be able to say, this is what the problem is, this is how we deal with it. Sometimes I'll be able to say that pretty certainly. Sometimes I'll be able to say this is probably the case. But sometimes we won't be entirely sure and we'll have to figure it out. But how we deal with that uncertainty is really critical. If I think your pain might be indigestion or you might be having a heart attack, you might be having a heart attack. I need to treat it as though you might be having a heart attack because that is something that could be very dangerous. And that involves trying to figure out the kind of uncertainty and the degree of uncertainty. And this comes down to a combination of the GP training things. One is the amount of medical knowledge and the breadth of stuff. So you know the sort of things that you need to be looking for that ring alarm bells. There are certain conditions and certain warning signs that are on my mind that if they're there, that kind of uncertainty I need to be acting on. However, if they're not there, then that leads to a different kind of uncertainty, as to a kind of safe uncertainty almost. And we can safety net it by saying, if these sorts of things happen, if you suddenly start to get pain in the middle of your chest going into your left arm and your neck, and you get sweaty and you feel like you're going to die, you need to go to hospital. You need to call 999 and go to A&E. But if we've managed to rule out all of the serious, life-threatening, debilitating conditions, and we still don't know what's going on, it leads to a different kind of uncertainty that, yeah, we need to deal with, but sometimes we never really get to the bottom of it. Sometimes things get better by themselves. Sometimes things are a little bit odd. Sometimes things are just a little bit uncertain. But knowing the difference between that safe, tolerable kind of uncertainty and the kind of uncertainty that we need to worry about is important, and that's part of our training and our job, and that's part of the importance of being a generalist, to direct things and know what is safe and what is not safe, even when you're not 100% sure exactly what you're dealing with. So we need to figure out what's going on with you and what's best for you. And you might be tempted to say, well, order loads of tests. Tests will solve everything. Give me every blood test under the sun and an ultrasound scan and an MRI scan and a PET scan and shove a camera up me bum. But that's not always helpful. And there are downsides to doing tests. I mean, for a start, do you really want a camera up your bum? But even beyond that, no test is 100% perfect. And the more tests you do, the more chance you have of picking up something that's wrong, that's not actually wrong. What does that mean? What do I mean by that? The best example that I can think of is MRI scans for research. I work in a practice where lots of our patients are students. Students are often guinea pigs for research experiments, and lots of those involve brain scans, MRI brain scans. Now, it's not uncommon for healthy students, healthy people, with absolutely nothing wrong with them, to get in an MRI scanner, have a scan of their brain, and the scan will show something unusual, something that's not quite normal. If you hadn't have had the scan, you would never have known that you had a funny shaped brain, and you would have been absolutely fine with it. Once you've found out, then the cat's out of the bag, but what do you make of that? Chances are it will never cause you any problems whatsoever, and if you hadn't scanned your brain, you'd never have known about it. But now you know. What do you do? Do you worry? Do you need more tests? Usually what we do in that kind of situation is another scan at some point in the future just to make sure that nothing's changed, but it depends on the details of it. That might seem like an extreme example, but it's true to some degree of pretty much every test that we do. No test is 100% accurate, so the more tests you do, the more chance you have of picking up something that's not usual but might not be significant. So we need to direct the tests to the ones that we think are going to give us an answer. If you have pain up here, we'll probably be checking your liver function. If you're a 60-year-old man and you're waking up during the night to pee, I probably will need to put my finger up your bum to check your prostate. I don't know why I'm talking about bums so much. Quite a big part of my job is putting my finger up people's bums. I was talking to someone about this the other day, and I reckon most days I have to either put my finger up someone's bum or check their balls. It's a strange job. So there you have it. There's a few things that are on your GP's mind during a consultation. There are other things as well, like how to kind of narrow down diagnosis and that sort of thing, but that's not really worth talking about here. The important thing is that the doctor and the patient are on the same level, seeing eye to eye about what's going on in terms of priorities, keeping you safe, what we can do next, how to direct the conversation a little bit to get the most information to build up a picture of what's going on, so as to direct how we can help things, how to manage uncertainty to figure out what's a safe kind of uncertainty and something that we need to really act on now, and when it's useful to use time to help with diagnosis, how to direct investigations and referrals to something that's going to help you and not cause new problems by finding something that we don't need to worry about. So anyway, I hope you found the video interesting. Maybe you're already starting to think like a GP and now you're thinking, well, these things would be useful to talk about during my appointment, and that way I can get more out of my appointment. And that is the topic for tomorrow, how to get the most out of your doctor's appointment. If you click the bell icon, you'll get a notification when it's released. Remember, click the like button, subscribe to the channel, and share the links. That way everyone will be able to get the most out of the doctor's appointment tomorrow. Spread it to the world. Share the love. See you tomorrow.